to that one first.
I thank the Minister for giving way and congratulate the honourable gentleman on securing this adjournment debate. We have been debating this in this place for months. Yeah. And the fact is that our constituents and patients still do not have access to Orkambi. Can I say to the Minister, it is time that ministers themselves took over these negotiations, took over responsibility for sitting face-to-face and eyeballing the company so our constituents get the justice that they deserve. These negotiations between NHS England and the drug company have got us nowhere, despite honourable members and right honourable members in this House's efforts. So can ministers directly now get their hands dirty, roll up their sleeves and participate in these negotiations and bring this matter to a conclusion on behalf of our constituents?
Hear, hear.
OK, well, look, the honourable gentleman has got his press release with his intervention. And maybe I should go back on what I said at the start of the debate then. And all he's done is taken away time from what is a very complex issue for me to try and set out a response to the honourable gentleman's adjournment debate. So, Mr Speaker, my honourable friend has called on the government to consider making use of the legal provision in UK patent law of Crown use licensing to break, as he puts it, rightly, the current deadlock. And as the honourable gentleman in a reasonable part of his intervention, yes, it is a deadlock, and it has been going on for some time. I commend his efforts in raising this. Indeed, it is right that we consider every possibility. Every single effort must be made to ensure that effective medicines are made widely available to cystic fibrosis patients. There is no doubt and there is no debate about that. I can assure my honourable friend that we too have considered this option. Indeed, I have received initial advice on Crown use licensing, and while the use of these mechanisms is not our preference, we are looking at all options. Crown use licensing is complicated and would not represent a quick solution to ensuring patient access to